So we've celebrated the 10-year anniversary of the use of ruxolitinib in patients with myelofibrosis, and we have become very aware of the success we've achieved with ruxolitinib, but also we've become very aware of some of the limitations, and particularly patients who achieve a suboptimal response or a response that is not long-lived, and unfortunately, nearly all patients lose their response and progress from therapy. So one way to tackle this is to apply a combination of novel agents that have non-competing mechanisms of actions and non-overlapping toxicities, in which we can design a more rational approach that attacks myelofibrosis at different steps and different paths. So Parsaclisib is a very favorable agent with a safety profile that inhibits PI3K delta, and in a phase 2 study that has been completed and will be presented in the final form in ASH 2022, it has shown activity in combination as an add-on strategy to ruxolitinib. So patients on ruxolitinib with the addition have achieved even more favorable responses. And this led to 2 randomized phase 3 clinical trials that are going on internationally, hoping to introduce this combination both in untreated, treatment-naive patients, as well as in patients already on ruxolitinib as an add-on approach. Once these studies are completed, and hopefully if they're successful, this will change the standard of care as we know it for patients with myelofibrosis, in which the combination therapy with ruxolitinib and PI3K inhibitor could become the new standard of care for all patients with myelofibrosis.